In this session on the musculoskeletal system, we're going to look at fractures. We're going to look at the main types of fractures, and we're going to think about how fractures heal, but really only at a very summary level. So adults have around about 206 bones. Some of them are very small, for example in the ear, and some of them are very large, such as your femur. But given the right circumstances, any bone can potentially break. However, of course, for a healthy bone, it does take quite a lot of force to break that bone. But of course, there are also a number of bone disorders that are associated with pathological fractures, and that includes things like osteoporosis, osteogenesis imperfecta, and of course, osteomalacia. And fracture is one of the commonest bone problems occurring as a result of injury in normal bone or because of bone weakening itself, such as in osteoporosis. And it leads to multiple morbidity and mortality in the elderly in particular, but also it has issues in the young. And when we're thinking about the elderly, of course, we're thinking about falls and we're thinking about hip fractures. So it is a very important public health issue. So first of all, we're going to talk about the different types of fractures. But what is a fracture? Well, a broken bone occurs when a force is exerted against a bone that is stronger than the bone can bear. And this disturbs the structure and strength of the bone and leads to pain, loss of function, and sometimes bleeding and injury around that site. So there's your simple definition for you. And these figures are a little bit old, but so there'll be a little bit more now. We're moving into 10 years later, 2020. But if we're looking at 2010 numbers, in Australia, there were around about 200,000 hospitalizations. 2/3 of hospitalizations as a result of falls in individuals over 65 of age involve at least one fracture. And femur fracture is the most common injury in older fractions who do fall. And it's estimated that around about 1/3 of older Australians fall in their home annually. But if we're looking at where the most injuries or fractures are, you can see that the most of them are in the forearm and the elbow. So you're around about 38,000 a year. You've got about 30,000 in the hip and upper leg. And then in the knee and the lower leg, you've got 27 to 28,000. And then you've got fractures elsewhere as well, of course. So who is getting hurt? So what's the demographics of this? Well, in the young, the young tend to get more fractures of healthy bones, in particular the tibia, the lower humerus, and the clavicle, and it's usually the result of trauma. In the workplace, it's often fractures of the hands and feet, and they're caused by incidents within the workplace itself. In the elderly, of course, you've got fractures in the upper femur, the humerus, wrist, vertebrae, and pelvis. And this is often associated with osteoporosis, so breaking down of otherwise healthy bone. And a lot of that, we'll talk about osteoporosis just a little bit later, but some of that osteoporosis in women in particular is during that menopause and beyond, due to a lack of estrogen, which of course is bone protective. And that bone density does drop in males as well, due to a gradual drop in testosterone. And pelvis fractures, of course, they are the most serious outcome of osteoporosis, and they increase. There's an increase in incidence with an aging population. And fracture of the pelvis, there can often be quite significant blood loss. Up to a litre or a litre and a half of blood can be lost during severe pelvic fractures, which of course can lead to hemorrhagic shock in severe cases. So if we're looking at these fracture definitions, so the types of fracture that we have, so a break in the continuity of the bone caused by the inability to withstand the excessive stress placed upon it. And we have a closed fracture. And as you can see, in a closed fracture, there's no piece of fractured bone is breaching the skin. So there's no breach of skin integrity. So that is known as a closed fracture, otherwise known as a simple fracture. So there's one example in the arm, and there's another in the leg, down at the ankle. You then have an open fracture. So obviously this is quite obvious. And this is where the fractured bone breaches the skin integrity. So this is an open fracture, also known as a compound fracture. And there you have a couple of examples there. So an open fracture, there are lots. This is where you'll need quite severe energy that is continuous and exceeds tissue tolerances to cause that open fracture. And it usually requires significant cleaning of the wound and almost certainly surgery. So we're thinking again about these fracture definitions. Remember, we're only going through this as an overview of the different types of fracture. You can have a complete fracture, and this is where it breaks through the bone, so there are now two parts, and this is the central image here. And you can see it just passes all the way through. An incomplete fracture, which you can see on the left-hand side of that image, this does not break the whole way through the bone, so that the bone is still in one piece, but it has a break in it. And you can see in this case the bone is bent, so that's most likely to be a green stick fracture, and you see those in children primarily. Oh, this is just what I've said. So the green stick is an incomplete fracture where the bone is bent, but not enough to break it. So that's just exactly what I said. And that's really because the bones are more flexible than those of adults. And then you have complicated fractures. And this is where the fractured bone causes further damage to nerves, potentially to nerves, organs, or blood vessels. And they're complicated because they can potentially be life-threatening, and they do require immediate medical attention. And then the last little image that you've got on the right-hand side here is your comminuted, and these result in two or more parts to the bone. And this can be down to simply smashing of the bone or multiple fractures in one bone. So your stable fractures can help to maintain optimum shape and structure and might only require splinting and pain relief to treat. And here's a nice little example of that. So you can say a stable fracture of the heel bone. You can see the structure is pretty good in that case. Unstable fractures, however, will not maintain the correct position without aggressive interventions. So you may need internal or external fixations. So here are just a few little examples for you, a few little pictures, and all I want you to tell me in each case is, does it look like a stable fracture or an unstable fracture? So let's start on the left-hand side. The first one, stable. Number 2, unstable. 3, unstable. 4, unstable. So there you have it, nice and simple. So we're going to keep going on. So fractures can be classified by the direction of the fracture line. And again, these are quite simple and obvious in their definitions. So you have the transverse fracture, and that's on the left-hand side. That's when the bone is completely broken perpendicular to the way that the bone is running. You have your oblique fracture, so that's the one on the right-hand side, and that's when the fracture line is at a diagonal angle to the long axis of the bone. And of course, then you have a spiral fracture, and that is basically a severe oblique fracture, but in this case, the fracture rotates along the axis of the bone, and that's generally due to rotational force, excessive rotational forces. So fractures can also be impacted and depressed. So impacted fractures occur when the impact on the bone is from one end, and the force runs straight up into the bone itself. And therefore the bone buckles under the weight of the other side, and the bone appears shortened because it's basically been impacted, it's been pushed up. And then you can also get depressed fractures, and these occur in the skull where a segment of bone gets depressed into the cranium, for example. And this fracture in this case shows a compound or open fracture where part of the brain is also visible. So it's a depression fracture and a compound fracture. So what I'd like you to do now is obviously press pause, because that's what we like you to do. And I just want you to tell me what type of fracture each of these are. So I want you to say, is it an open fracture? Is it a closed fracture? Is it complete? Is it incomplete? Is it comminuted? Or is it impacted? So press pause and have a little bit of think about each one, and then we'll run through them. So the first one. So if we're looking at this first one, you can see that it's closed and it is complete. And it's closed because it doesn't break the skin. And it's going to be, looking at it, it's going to be relatively stable. But it's also transverse. It's going across the bone. Then you've got the second one. Well, if the first one was closed because it didn't break the skin, this second one is obviously going to be open. And again, it's also complete because it's gone all the way across the bone. And this is one, of course, is going to be unstable. Third one. So third one, if you're looking at this one, you can see it doesn't go all the way across, and it also hasn't broken the skin. So therefore, it's a closed fracture, and it's incomplete because it hasn't gone all the way across the bone. And if you saw it as being bent, in this format, you'd be thinking closed, incomplete, and you'd be thinking a green stick because it had that bend to it. Next one. So what are you thinking in this case? Well, again, has it breached the skin? The answer is no, so it's closed. Is it complete? Well, yes, obviously it's complete. And it's also comminuted. And that's because it's been broken into lots of pieces. And of course, it's also going to be unstable, as you might imagine. And the last one, again, has it broken the skin? The answer is no. Has it completely broken? Yes, it has. So it's complete. So you know it's closed, you know it's complete. And you can look at that and tell that it's also impacted. Because you're getting force from one end pushing onto the bone. So you're shortening that bone length. And it's likely to be unstable. Okay, good. Hopefully you got all of those right and they weren't too challenging.